Hi, my name is Dr. Ravi. I'm here at the coffee shop at Digestive Health Center. The goal of this series, which is being called Coffee with Ravi, is to inform and educate you on various trends in digestive health so that you may use this information to better take care of yourself. My first post today is about COVID-19 and how it can specifically affect the digestive system. As you know, the first description came out in China in December, where there was a new novel virus causing pneumonia in China. From that point on, it has spread through the world, causing the current pandemic. Most symptoms relate to the respiratory tract with shortness of breath, cough. However, patients can present with diarrhea and digestive symptoms as the first symptom in their illness. This diarrhea can happen up to 4 times a day and can last up to 2 weeks. In a subgroup of patients, about a third of the patients did not have fever associated with their digestive symptoms. In other words, diarrhea can be a presentation of COVID-19. As you know, the virus enters through the lung cells, and there is a possibility that it could enter through the digestive tract because the same areas that the virus attaches to in the lungs are present in the digestive system. As you know, coronavirus is called coronavirus because of the spikes on its surface, and these spikes attach to certain areas in the body called receptors. This virus is surrounded by an oily bubble, and therefore the oily bubble can break with soap and washing, which is why there is this emphasis on hand washing. My post next week will be what you can do to prevent infection and what we are doing here at Digestive Health to prevent infection and transmission at a departmental level. Thank you for joining us today. For more information on this topic, please visit us at www.cedarvalleygi.com.